Yep.
I will go ahead and start recording. All right. Hi, everyone. Thank you for attending today. We're going to get started in just about a minute while we wait for some folks to trickle in, but we're happy you're here with us tonight. Hopefully you've brought some questions. Feel free to submit any questions right now that are just burning that you really want to ask. Feel free to submit them to the Q&A or the chat, and we're going to get to them shortly. But we're going to give it about one more minute for some folks to trickle in. This session is going to be recorded so that way we can promote on social media networks. But if you do not want your name attached to any of the questions, that's no problem. You can submit all questions anonymous. So that is an option in the Q&A. All right. Looks like I have right after 5 o'clock, so let's go ahead and get started. Hi, everyone. I would like to welcome you. The University of North Florida and the Florida Academy of Nutrition and Dietetics have partnered to host this Ask the Florida Candidates open panel, where it's really y'all's questions and some questions that we've prepared. We'll really just get at why are these candidates running for the Academy election and what change might they be interested in pursuing. So without further ado, I'm Dr. Kristen Hicks-Roof. I'm going to be your moderator for tonight's session. And then we also have Peggy O'Neill. Peggy, I'll pass it off to you if you want to make some comments.
Thank you very much. Yes, my name is Peggy O'Neill. I'm the president for the Florida Academy of Nutrition and Dietetics, and very honored to be here tonight to introduce to you the four, actually there's three attending tonight, but there are 4 candidates on the Academy's ballot that are all part of a very influential position. So I'm very happy to be sure that you all know who those Florida candidates are, so you can learn, what they're all about, and you can learn, who you want to vote for and what kind of things you want to see from the Academy. These are the folks you can ask that to. My quest to you is not only that you vote, but you ask all of your other colleagues and dietitian friends to vote as well. This year, Florida would love to be the #1 affiliate that has the highest votes. We are a very strong and influential group and state, and so I'm hoping that you can help us to make sure that our voice is heard by having these 4 candidates on the ballot and on the Academy's board, but also by, ensuring that we're all coming out and voting and speaking up for things that make a difference for us in Florida. So I'll give it back over to Dr. Kristen Roof.
All right, thanks, Peggy. And yeah, we're excited to, collaborate on this wonderful way that we can represent and learn more from all of the candidates. So I'm going to give 1 minute to each of the candidates. Remember, we do have 4 candidates that are running from Florida. One is not here tonight. So we have Dr. Lori Wright. She's running for president-elect. We have Krista Yoder-Latour. She's a treasurer-elect candidate. Dr. Leslie Gordon. She's a director-at-large candidate. And then Lucille Bessler. She's a national leader with board of directors experience in the past 10 years. So we will start out, Dr. Lori Wright, if you want, you have 1 minute to do a brief introduction.
Hi, everyone. It's an honor to be here. I'm Lori Wright, and just a little bit about myself. I came into the field as a clinical dietitian. I practiced over 10 years within the VA healthcare system, then became a dietetic internship director, starting the Bay Pines VA internship, and then directed a few more internships before settling back into Jacksonville as the director of the doctorate in clinical nutrition, only the 2nd practice doctorate in the nation. And I am also the department chair. Within the Academy, I started out my volunteer work in dietetic education. I was a site visitor for Ascend, and then later went on the Ascend board. Then I was honored to be the president of the Florida Academy, where I really focused on listening to members and trying to break down those barriers and find solutions to the issues they brought up. We also focused a lot as a public policy team on licensure and passing a model practice act, and then working with further with leaders, including Lucille Bessler, in really protecting the strength of that Practice Act. My latest position with the Academy has been as the Speaker of the House of Delegates, where I dedicated my whole year to working on solutions to diversity and inclusion. And that included beginning the first MIG delegate representation to help increase diversity. We also focused on trying to modernize the organization of the House and the Academy. So thank you again for letting me be here.
All right, thank you, Dr. Wright. And while we're introducing ourselves, if you have any questions, feel free to submit them to either the Q&A or the chat function. So our next candidate is going to be Krista Yoder-Latour. And Krista, if you want to go ahead and introduce yourself, you have 1 minute.
Thank you, Dr. Rufix. So my name is Krista Yoder, Latour too, and I am running for the position of Treasurer-elect. My background is really in business. I've also worked in clinical, community with WIC and FNEP, but really for the past 15 years, business has been my focus. So I am a business executive, also a social entrepreneur, which for those of you wondering what that trendy term means, it's really talking about looking for business solutions to doing good and filling gaps in care. And so the two most notable companies I've started to really work at those gaps in care that I've seen over the years is first an organization, Family Food, that I started in 2009, headquartered in Philadelphia, doing in-home nutrition counseling. So one-on-one nutrition counseling for the entire family. We work with a number of different insurance plans, including Medicaid, really looking at that access piece and making sure everybody has access to RDNs. The second company was focused on corporate wellness. And so we have dietitians who go into companies and do nutrition counseling in those locations. And that company I actually sold 2 years ago to a larger parent company. I was retained as president of provider networks for that larger organization. And so now I oversee our national network of registered dietitian nutritionists, as well as a national network of health coaches, and also a network of diabetes educators. And I am tasked with acquiring additional networks, so additional teams of RDNs, and bringing them all together for a unified voice and to have exponentially more impact on people. So as you can imagine, acquisitions include a lot of financial assessment of an organization's financial health. And so I work with really big budgets and do a lot of financial assessments, which is one of the reasons that I'm running for the position of treasurer-elect. I also am a certified business analyst, which I use in that role a lot as well. And then for the Academy, I've served in a number of positions, starting with the local organization when I was in Philadelphia, serving for the district, a variety of positions, including president. Then I worked with the state in both Florida and Pennsylvania for pretty much every kind of advocacy legislative position you can imagine, the PPCs, the SPRs, all of those I've done between the two states. And then more recently, I was on the Legislative Public Policy Committee, working at advocacy there at the national level for the Academy, and was chair of the Nutrition Services Payment Committee, where we collaborate with payers across the country to try to advocate for increased payment and services for RDNs. So really excited to be here tonight and connect with all of you.
Okay, wonderful. Thanks so much for the introduction. And last but certainly not least, Lucille Vessler, the former Academy president.
So I have to say something before I introduce myself. I am so excited that these two wonderful, talented women want to give of their time to lead us and to make our profession better. So I'm really excited, and they are just wonderful. So let's hear a little bit about me. So I have been, I'm an entrepreneur. I own my own company, Family Nutrition Center of South Florida. We do a lot of different things. We do counseling. Of course, we do a lot of telehealth now, but we have another arm of our company where we have business clients where we help their clients get reimbursed for nutrition services, most notably nutritional supplements, such as infant formula or specialized tube feeding. So that's called our insurance navigation program. So I've been in business for 31 years, and I've reinvented our business every couple of years, no matter what's happening. So COVID hit and we had to reinvent, and we actually moved our whole business to everyone's home. So all our staff are working from home. So I kind of think that as a registered dietitian, I'm also a certified diabetes educator. I think that our unique education and our experience really lends itself to that reinvention. So, that's how you're going to stay relevant. That's how you're going to probably rise above some of the competitors. And that's what I've done in my business. So for the academy, so I guess I'm a serial volunteer person. I don't know, that must kind of sound a little bad, right? A volunteer, but I think I've been volunteering for about 28 years. I just gave a presentation and I blame it all on Chris Staple. I always say it was her fault. She grabbed me in the hall. Be very careful when somebody grabs you in the hall and they start telling you how wonderful you are. No, that hooks you in. So I've been hooked in. So now I have been on the licensing board for 9 years. You only supposed to be on for 8. I don't know how I got on there for an extra 1. I was the president of Florida. Grateful for that. I was the chair of the Academy's Political Action Committee. I was on the board of directors, and then I was asked to run for president. That was very humbling. Most people who know me know I never aspired to be the president of the Academy. Never really thought I had the stuff for it. These people have the stuff for it. I never thought I had the stuff for it. But I was really honored when I was asked. And, I always feel when you're asked to be pressed into service, it is your responsibility to step up and say, yes, I'll do it. So it was really a wonderful experience. So what am I doing now? Well, I was asked to be on the nominating committee. And you know what? I think it's a really important committee because I can find wonderful people like Krista and Lori and Leslie, who isn't here. I can go and look for those people and bring them into the leadership pipeline. I think I know what it takes to be a leader, what skills you need. And I will tell you what I think is so very important, what our candidates have, Krista and Lori, and they didn't pay me for this, but it's a pure heart, and they both have a pure heart. You're not doing it because you want to see your name in lights. That's always fun to see your name in lights, but that's not why they're doing it. And that's not the people that I'm going to be seeking out if I get on the nominating committee. I want those people who are doing it for the right reasons, that we have to press them into service, that is not on their wish list. And, they don't have their own ulterior motives. So I'm running for nominating, and I hope that, that people would consider voting for me.
Okay, thank you so much. And so empowering, right? Because I think you all have heart, and it's really evident that you all have heart. And I think that's so important to bring to the profession. So attendees, if you have any questions, feel free to submit them through the Q&A, but I'm going to go ahead and get us kickstarted. Okay, all the panelists, you have 30 seconds or less to respond to these. So keep it nice, short and sweet, so that way we can move to the next question. Every person has an opportunity to respond, especially if you feel like it's relevant to you. If you don't feel like it's relevant to you, you can pass if you would like, okay? So the first question, we will start with Krista because you're the first on my screen. What is one leadership trait you feel you bring to the table that can help advance the Academy?
So I think it takes a number of different qualities to be a leader, right? For myself, what I see myself kind of bringing to the table in different committee meetings and things of that nature is kind of the systems thinking, right? So for me, what's really important to me is that we reach the most people possible in the most effective ways. And to do that, often the more we work together with other organizations and have collaboration, the more exponentially we can reach people and provide service. So for me, that's systems thinking of not just looking insular to ourselves, but looking external to say, how can we collaborate, work with other organizations to really elevate our message so that everybody knows RDNs are the nutrition experts.
Okay, perfect. Lori?
I think a quality that I would bring is a vision. I see so much potential for this profession and our organization. I truly believe in the mission of the Academy, the transformative power of food and nutrition. And I think there's so many opportunities. And we really have to pull together and move our profession forward. And I think that with that vision, I have the ability to execute through the connections I make and the passion that I bring with that.
Okay, perfect. Lucille?
You know, not to duplicate what Lori said, because I was writing, I'm a visionary and I think that I can see that in other people. And that's what I will need to use to find people, you know, to nominate for positions. I need people who have vision, not the same old, let's just do it that way because we've always done it that way. Also, you know, I always say, and I've always said, I'm the chief motivating officer. I'm very motivating and I can see people who also can motivate others. And I think that's a really good quality for the position that, that I would be running for.
Okay, great. Thank you all. So our next question comes from the audience. They're asking about compensation for dietitians. We know that this has been a battle for a number of years, just reimbursement. What can we do, or what do you propose or strategize or hope for to help with that issue? And we will go with Lori first.
Oh, advocacy. We have such an opportunity right now with two major acts, the Medical Nutrition Therapy Act and the Treat and Reduce Obesity Act. Every dietitian needs to be talking to their legislators, their federal legislators. We have to expand coverage for dietitians. And right now we know that the coverage is very limited because we weren't at the table in the 60s and we've been playing catch up ever since. This is our time. This will move us forward tremendously. And the Academy has really armed us with the information that we need. Krista and Lucille and I we met with one senator and we'll be meeting with another senator on Friday. This is our opportunity to really help with that reimbursement piece. I think also we need to continue that networking with other professions and raise, you know, how we're seen through interprofessional work with the physicians and with nursing and such. Not to look at them as competitors, but as allies, that we all can have a piece of this and again, elevate the profession and those opportunities for reimbursement.
Tough answer to follow. Lucille, how are you going to follow up with that one?
I can. Outcomes. So she says advocacy, she's right, and it's outcomes, because without outcomes, we can't prove our worth. We have to prove we're the best things that exist. We have to prove that we can help patients improve medical conditions, reduce the cost of medications, evasive procedures, only with outcomes. And none of our members, or I shouldn't be so general, a very small percentage of our members actually capture outcomes and share it. So what do we have to prove? Just our word. We do a really good job. That's not enough. Not enough for the payers or the legislators.
I can imagine Krista's about to comment on this. Go ahead, Krista, you're next.
Well, Kristen knows how much I love outcomes and am constantly pinging her for help with my outcomes. So certainly agree with everything that's been said. And just to add one more onto that, I think the unified voice is what the Academy's unique role is it brings us together, it gives us a unified voice, and all of us doing our own thing, advocating individually is never going to have as much power as us unifying. And so that's where, I see kind of the question in the chat around how does this impact all of us? We will all be better results for all of us if we're unified in our voice.
Okay, wonderful. We're moving to the next question. Again, try and keep your responses brief. Is there a particular issue that motivates you to serve on the board right now? And we will go with Lucille first.
I just want to see the future bright. I want to see our members do well. I want to see our profession do well.
Okay, Krista?
For me, it's diversity, equity, inclusion. And I know the Academy has added access on that acronym. That has pre-2020 always been a very important part of, I think, what dietitians do and need to do more of. I specifically, in addition to, my financial experience, another reason I'm specifically running for treasurer is because I appreciate the effort and intentionality that did go into the IDEA plan that the Academy has been developing around DEI access IDEA. But I want to make sure it's financially funded, right? So all budgets should always reflect a strategic plan. They need to align. So I really would love to support those efforts to make sure that the IDEA plan actually has the financial funding to make it come to fruition and to make it longstanding.
Wonderful. And Lori?
Love both of those. I was at an interesting place this summer. I really feel that we have a lot of polarization among our members. And it's similar, I think, to or reflective of what we're seeing in the nation. People are, really opposed and instead of working together, they're fighting each other. And so I see that we need leaders that are going to pull us together. And that requires, as a leader, to be vulnerable. We need to be open and listen to our members, engage them, including IDA. We did wonderful listening tours in 2020, but we need to continue those. We need to listen and find solutions to the barriers and the challenges that dietitians are experiencing. We have a lot of competitors out there. We have to pull together in that unified voice and effort in order to advance our profession.
Okay, wonderful. The next question kind of gets to you more as a person. How do you balance all of your responsibilities and other roles, especially when trying to take on a new leadership role? And we will start with Lori.
Oh, that's tough. I am a multitasker, so I thrive in the mission. So sometimes I'll be tired and I'll go into an Academy meeting, for example, advocating with our senators, and it's just energizing. I get so much energy from being a part of this amazing profession. And my work, I love what I do with my students. And so I really like to dedicate myself to those things that give me energy, and so that I can do the best at those areas and try to cut away some of those areas that I don't get the pleasure from, and that I don't make as much contribution. So that's where I have to balance is decide what brings me passion and that I can do my best with.
Okay, Krista?
Certainly, just building on Lori, your point about passion, for me, that reward from that passion comes from me always, trying to use these different roles and hats to solve for the bigger problem. What's the need? How can we solve for that? And so in my daily professional life, that's using business to solve those needs. But there's a lot of needs across the country and the world that business industry cannot solve for. Only professional associations like ours, of the nutrition experts can solve for those problems. And so that's where I draw on that energy that comes from the significant impact that the Academy and why I really enjoy being involved and taking part in that work.
Okay, perfect. And Lucille?
Kind of to add to what both Krista and Lori have said, I get a lot of satisfaction from volunteering and seeing our profession do better because of our volunteer efforts. Where do I cram it in? Who knows? Hey, we do it, right? I always say you have time in your day to do something that you love and you enjoy. And funny, I always did mention while I was president, I had to work. So it's not that I needed to, I'll take a year off and have to work. No. I needed to do that. I needed to pay the bills. I'm very fortunate to have great staff that support me, and really our Academy cheerleaders also, even though they don't belong to the Academy. So I get a lot of support and a lot of personal satisfaction, and I guess I just find the time.
I love that. Again, you see so much passion across all of you. And I think that is really what it takes to be a leader. Not only the strategy and the vision, but also just the passion and wanting to be a leader. Because like you said, Lucille, a lot of this is volunteer and, you might be balancing a lot of roles. So I appreciate those comments. Okay, so we have another question from the audience. They're asking, what sort of diversity and inclusion efforts have you worked on with RDs and non-RD professionals? And we will start with Krista.
So I already shared that is one of my key priorities in being a candidate and as an RDN. My work thus far in these areas has I would actually like to move the needle, right? Like, this is not lip service. I really want to see the demographics of our profession change. And my efforts thus far, obviously supporting diversified dietetics. I have spoken 2019. I was asked by the Diversity and Inclusion Committee to speak at FAND, and so I co-presented and additionally have co-authored an article on privilege and power in dietetics with Dr. Rodriguez, who I believe is your colleague, and Ann Lund. We co-authored that. That was in the journal over the past year or so. Trying to think what else comes to top of mind. I recently in the past year also co-presented with past chair of the Diversity and Inclusion Committee at the International Congress on Dietetics. So those are some of the practical ways that I've tried to push the message, especially as a white dietitian. I think we need to elevate dietitians from diverse backgrounds, make their voices heard, and at the same time be allies and call out each other when we need to be called out.
We appreciate your efforts so far. What about you, Lucille?
So I could think about how I of examples in the past and then what I would do in this position. So at the time when I was president, I appointed more diverse candidates to committees than any other president. So I go down with that. That was something I was very proud of, not something that I publicly talked about, but something that I was very proud of. And proud about that in business. In business, I work with a lot of other groups, not just dietitians. So But how do I think that'll impact if I am put on the nominating committee? I think it's really important for us to not look for diversity amongst many areas, not only ethnicity, cultures, but diversity of ideas too. So that's something that I would be, obviously a big proponent of on the nominating committee, and seek those candidates that come from very different backgrounds with different ideas.
And it sounds like you've already done, you had some history in that. So that's great to see that you want to continue moving those efforts. And what about you, Lori?
Well, as I had mentioned, when I was Speaker of the House, I worked very closely with the D&I committee to identify gaps. They were doing amazing work, but where were the gaps that the House could assist with? And so we did several different initiatives. One was individualizing the new dietary guidelines to different cultures. Another was around a toolkit, which I have championed, a toolkit that would bring programming to reach more underserved communities and provide nutrition services and care. And then, of course, talking with MIG members and what would help them. And that's where we came up with the idea to add a MIG representation in the form of a delegate. When I was on INDEP, when I was the chair of INDEP, we started a mentorship program for new internship directors and for internship directors that were having trouble with the RD pass rate. And many of them were from historically Black universities. And I was able to learn about a lot of the challenges that the students have about being able to afford an internship or graduate school. The challenges with moving. They often are not able to move to go to internships. So really trying to help with some of those barriers that the internship directors were experiencing on behalf of their students. And non-dietitians, my big emphasis in my work is around health disparities. So I run programs that provide more services to diverse groups and underserved populations. That includes food as medicine programs at clinics for medically underserved groups, and then also our Meals on Wings, our home delivered meal program that targets low income seniors that are on the wait list for Meals on Wheels. So those are some of my efforts, both within the profession and outside, to increase diversity in those served.
And I appreciate you all commenting on outside of the profession as well, because it helps, really show the role of the dietitian or why nutrition is important. So I appreciate you commenting on both sides of that aisle. So another question coming in is how do you promote academy membership? We know that there might be some people who are not involved in the academy. So how do you promote that and benefits of being a member of the academy? And we will go with Lucille first.
It's not easy, but you need to have, if you are in your, let's say in your position, maybe you work in a hospital and you're the lone RD in your group that is an academy member, it's always really good to get facts and figures to show your colleagues what the benefits of the academy membership provides. So we could always talk about the evidence-based library. Just the cost of that, if you had to subscribe, is pretty high. And that's a really good perk to have. So I think it's really important to say, look at all these benefits you get. The other thing that people seem to forget, if we do accomplish something, non-Academy members benefit from that, don't they?
Mm-hmm.
So when we had a big problem with Aetna, and when we were on Nutrition Services Payment Committee, we went and negotiated with Aetna and we got payment for certain conditions. Everyone who was in private practice who was billing Aetna benefited. The people who were non-members as well as the ones who were members. So I think the important way to do that, get your facts, show them what membership brings. It's not so expensive. So always try to compare it to, it's like a cup of coffee, you know, a week or whatever. And if you need stats from the Academy, they're willing to give you that so that you could have a, you know, kind of a membership drive.
Okay, perfect. And again, I see the passion with all of you. I love it. Okay, Krista, what's your response?
So agree. I think people need to know what benefit they're getting. And, you know, many of you on the call today have seen the Academy in action. You're here today because you understand the importance of the work that the Academy does. I know just from being on Nutrition Services Payment Committee, Lucille referenced how that committee worked directly with Aetna to get some of those issues corrected. I think a lot of members don't know that we have Academy representatives from that committee who sit on the AMA, the American Medical Association's coding, different coding committees who create these codes that people use for billing, right? And for reimbursement. I think the level that the Academy interacts with some of these much larger entities like the AMA, like Centers for Medicare and Medicaid Services, I think if members realized and knew more, that they would really see the benefit that the Academy gives each of us individually as RDNs and NDTRs.
Okay, wonderful. And Lori?
I echo what Lucille said, in that all dietitians benefit by the work of the Academy. When we were advocating for our licensure, that benefited all of the dietitians in Florida. When we are advocating with our legislators federally, that reimbursement, as she said, is something that benefits all dietitians. I just did a talk with a Student Dietetic Association last night, and I start with the student benefits, and I really think we have to get the students in early, and just see, you know, just the power of coming together, and then with our members. Often when we engage them, like Chris Staple did to Lucille early, the younger they are or the earlier in the career that we engage them, we help keep them in. But you can show the cost benefits. There's so much beyond advocacy and reimbursement. The Academy is pulling together all that data that we can use to help reimbursement, but that data and research that keeps us cutting edge through the nutrition care manual, the evidence analysis library, the nutrition care process, and Andy. So many benefits to keeping us at the top of our game. And I never, you know, we have great infographics of those benefits for students and for practicing dietitians. But I have to say, I always talk about the benefits of the networking, where you can you can meet people working in your area. You can, you know, email, text, pick up the phone, and have that instant connection. And you know, that if you think back to that first time, for me, I remember going to FAND the first time I was a young dietitian, looking around at all these other dietitians, and it was like, oh my gosh, I'm home. I found my people. That networking is just that's you can't put a price on that, can you? So I try to point out those different benefits to members.
You bring back so many memories. I remember when I was a young student going to my first FAND, and I felt the same thing. Like, wow, I always called it my dietitian Disneyland. I was like, This is it, right? This is it. So yeah, I think that's so important. And it's really, in addition to all the benefits that they provide, I think it's a great opportunity. If you look at all of your histories, you were involved in several different committees, sometimes took leadership roles. And so having that participation may grow into other participation and maybe, move you up the ladder if that's something that you want to as well. So I think that's really evident from all of you is the Academy provided opportunities, which really maybe helped get you where you are today or grow to the capacity that you are today. So thank you for responding. So we have another question coming in from the audience. Remember, if you have any questions, feel free to submit them to the Q&A. It can be anonymous as well. What are you most proud of if you had to choose one thing in your career? Remember, keep it short. Okay, we will start with, let's see, Lucille, you're my first on the screen.
This is easy, very short. I've been in business for 31 years. I have not had to work for anyone for 31 years. Guess what? I'm very proud of that.
Wonderful. How about you, Krista?
I think for me, my proudest accomplishment thus far, or I should say, I hope that the legacy I leave further down the road is the connecting the Medicaid population with RDNs. And so to that goal, I've expanded or added coverage for nutrition services, MNT by RDNs to several Medicaid plans at this point. I've led the task force for the Academy in drafting the advocacy toolkit for Medicaid advocacy toolkit, and was the lead author on that. And so I hope that only continues. I hope eventually all Medicaid plans cover MNT by RDNs.
That's great. And Lori?
My biggest source of pride, I think, is our food recovery meal delivery program, Meals on Wings. We recover food that would normally be wasted from area hospitals, package that into healthy meals, and then deliver directly to homebound seniors, all with the power of our student volunteers. The program we have outcome data on, it shows that our seniors, they improve their food security level, their nutritional status, their nutritional intake, and also their isolation decreases and their social well-being improves. But the benefits for students of them applying what they learned in the classroom, their leadership skills improve, social responsibilities, it is a win-win for all of the students. In close to 3 years prior to COVID, we were serving about 25, 30 seniors. After COVID hit, we knew people needed help. So we expanded to 100 seniors within the first 2 weeks of COVID shutting us down, and then shutting the nation down. And then we are currently at 250 seniors. And we're getting ready through seed grants to expand nationwide to 2 more sites in the nation. And I'd love to see this go farther and farther, because this is a way that we can really benefit. We can provide benefit for our student learning, but also meet this need of our homebound senior population.
That's amazing. I mean, just all the accomplishments. I'm sure it was hard to choose just one, but I appreciate you all sharing. And it's such a prideful thing, right? Like you said, Lucille, owning your own business. I mean, how much pride goes into that? And Lori, impacting those food insecure seniors, and Krista, reaching populations who wouldn't normally have those coverages. And so those are the things we want to see in our leaders. And I hope all of you who are on the call see that. They see the vision, they see the passion. So I appreciate you responding there. So we might already know the answers to this question, because based on what some of you had said, but are there any specific populations that have existing gaps in care that you're most interested in solving? Krista?
One that is top of mind for me right now is community-based, we're talking about outcome data, community-based research. So for example, I know there's a huge malnutrition initiative that the Academy has taken on and championed. And there hasn't been a lot of work around malnutrition in the community setting yet. We have lots of data in the clinical setting, right? And the measures and everything that go along with that. But that is one thing that's kind of on my radar. I'd like to begin to see malnutrition and make the case for dietitians in the community setting addressing malnutrition. And then also, along with that would be food insecurity, right? So I'd love to get more data around that MNT, that nutrition counseling with dietitians, can improve food insecurity rates. So the actual counseling itself, in addition to food as medicine efforts, can empower somebody to become more food secure. I'd love to, I mean, obviously we're trying to work towards that. We gather, tens of thousands of data points throughout the year in my businesses. And so that's really on the radar to begin to pull together some of that data. We do have my companies have a relationship with the research team over at the Academy, and we feed them our data set. And so that goes into the evidence analysis library. And so we're really hoping to support some of those efforts in the coming year or two.
Okay, and Lori?
Well, very similar to what you were saying, Krista, but really trying to tackle these health disparities. And I think dietitians are in this unique role to accomplish that. And one program, the Food as Medicine program we have is really focused on those health disparities that exist in the food insecure. We know that they're making choices between taking their medication and having enough food to eat, or going to the doctor and having enough food to eat. So I think it's really important that these programs, not only we provide them healthy food baskets, but we also have to empower them to make these changes, to control and manage these diseases. It's actually even more important because they don't have the access to the medicines as much, or the healthcare provision. And so really packaging that into, food, skill building, knowledge building, and motivating, so that they can take control of this disease. And again, it's the dietitian that can do this. And if we could help dietitians go into their own communities. You hear all the time of dietitians that they are volunteering at the food pantry or food bank, sorting through food. I argue that dietitians should use their skills to go beyond that, to do some of these cooking classes or food as medicine classes. And so I would love to develop this toolkit that would help dietitians do that if they want to, and develop a mentor program so that those that are already out there doing it can help others that want to go into their communities and make that difference.
Right, so many opportunities. You guys are making me think of all the things that I wish I could do and go out in the field. So you're inspiring. What about you, Lucille?
It's so funny how we all kind of intersect in different places, and things that I haven't mentioned. I have a foundation, Family Nutrition Center Foundation. So we do work. Our areas of interest are addressing and identifying children who are suffering from obesity or other health related diseases, like we see asthma. So we're working on some grants to try to address getting them access to nutrition services, kind of like what Krista said. We are on some Medicaid managed care plans, but we're looking, how can we get these kids to access our services, and how can we do that through our foundation? We've done work before. I have two other things that I'm interested in. Because of the increase in diabetes and gestational diabetes, I think that we're going to see a big impact on infants. I've written a book on feeding infants and toddlers. That is really my passion. So I'm thinking if there's a way, again, that we can provide education to gestational women who have gestational diabetes and provide them really good nutrition education, and then follow those babies for a while and provide the mommies good nutrition education for the babies, wouldn't we get to see really good outcomes? So that's something else that we're looking at through our foundation. If anybody has really good ideas about this. And the last thing is our insurance navigation program. To me, everyone who's malnourished, who needs a medical nutrition supplement, it should be paid for by the insurance company. Any baby who has to be on a specialized formula, it should be paid for by the insurance company. So we still continue to advocate for that and kind of throw out our net even further to try to get more companies involved in advocating for that. So I think we're all very ambitious, aren't we?
I would say so. I'm going back to the question earlier. How do you balance all these roles and responsibilities? I'm still not sure. Maybe I can learn from all of you. Okay, we're going to try and squeeze in 2 questions in the next 7 minutes. So we're going to be short and to the point. In the chat, they're talking about, how important the Academy membership is in terms of networking. So I want to know, what's one person that you've networked with because of your Academy membership that is getting you to where you're at today? So we will go with Lori first.
Oh, wow, that's tough.
We got to be fast, Lori.
One person that has, I've had so many mentors, and oh gosh. Well, Lucille has been a wonderful mentor that I met through the Academy, and she stepped up when I was president of Florida and helped me through a very difficult time. She has continued to really encourage me to stretch. I wouldn't have gone for that role as Speaker of the House of Delegates if it hadn't been for Lucille. So I think she has made a huge impact on my journey here in the Academy. So thank you, Lucille.
No, thank you. That's so sweet.
Well, let's pass it off to Lucille. What about you?
I told you we're ready. If I have so many dear friends that I have met through the Academy that have made me grow and become better and better. I always say your friends make you better than you are. But number one has to be Chris Staple. She's the one who pressed me into service. And then from there, but there's been so many wonderful people. Can't even name just one. And thank you, Lori. That was so sweet.
Okay, Krista, you're up.
So I think I'm going to name somebody outside of our profession, but it's because of our profession that I was able to connect with them. So back when I was living in Philadelphia, the Pennsylvania affiliate had an initiative with the Pennsylvania chapter of the American Academy of Pediatrics, where they were sending out a pediatrician and a registered dietitian to pediatric practices throughout the state at no cost. It was this grant program. And so I was one of the dietitian presenters, and I happened to present with a pediatrician who happened to be the medical director for one of the largest Medicaid programs in Pennsylvania. So of course, at the end of our presentation that was pushing dietitians as everybody should have access to these services, I said to her, did you know that your members cannot access these services that you've been preaching about for the past hour? And she did not know, and she was very surprised. And that week, we got it written into the plan. And that was the first Medicaid plan that we started working with. It continues to be our biggest payer to this day and a great relationship. But that relationship would not have happened without being involved with the Academy and being one of those speakers with all that networking that happens.
That's amazing. All right, our last question, and thank you so much for all the attendees who sat in with us, and for all of you who were watching the recording. We hope that you have been inspired over this evening. Okay, so what is one achievement that you would like to see happen if you were elected into office? What is one achievement? Lucille, we're going to start with you. You got to be fast. We got 1 minute.
Oh gosh, if I this and looking for, I would like to see a robust leadership pipeline. That's what I want to achieve.
Okay, perfect. Lori?
I'd like to see us expand our international collaborations and work.
And Krista?
I would like to see a national campaign from the Academy on the importance of RDNs and the work that we do to spread the word to everyone that we are the nutrition experts. I think it would give members trust that they're getting member benefit. They're seeing all the work that we're doing and how we're working for them. And of course, it would lead to more recognition for our profession across the country.
That's amazing. So it's so inspiring. I really appreciate it. So I'm going to give everyone about 30 seconds to say one final comment before we close. You can talk about anything you'd like, but ideally keeping it to 30 seconds. What is that power punch? If you want to get people to vote, how are you going to show them? So we will start with you, Krista.
I would just say first, thank you for joining today. Please you took the time to join, so clearly you care. Thank you. I'm assuming that you're going to vote as a result of this time that you're putting in. So thank you for making your voice heard. I will just remind you that the reason I'm running for the position of treasurer-elect is because I do have thankfully, I do have a strong background in finance through acquiring other companies, working with huge budgets. I've served on the Miami Budget Advisory Committee. I was appointed by the mayor, served for 2 years. I am a business analyst, so I have that financial acumen. And the 3 areas that I really am committed to championing is making sure people know that we are the nutrition experts, diversity, equity, inclusion, and advocacy work.
Okay, Lori?
Again, to reinforce, please make your voice heard and decide the future of the Academy by voting. I want to be your president-elect so that I can listen to you and support members and unify the profession so that we can soar to where we really should be. I want to be an advocate for you as members, and I want to be an advocate for our profession outside. I really feel that I have those skills to bring us together and the passion to see us move forward.
All right, and Lucille?
Thank you so much. First of all, thank you, Dr. Roof, for hosting this. It is really pretty exciting. I'm so glad that you got to see these wonderful candidates. I'm going to tell people, vote. Not only you, but grab 3 of your friends, 5 of your friends, get them to vote too. Maybe you could do it at lunchtime. Please get the vote out. It's really sad when we only see 8% of Florida, one of the biggest states, one of the best states, only have a turnout of about 8%. So please vote, and I hope you vote for me because I think I know what skills someone needs to be a leader. And I think the future of our profession is so very important and will go where it needs to go with the right leadership. And I do think it takes someone who can really understand people, see some good qualities, see vision to identify those future leaders. So please vote, and I do hope you vote for me.
Well, we are closing out our hour. Thank you so much, candidates, for really, opening up and so much, I feel like, inspiring of where we can go as a profession and how you've contributed and where you see your contributions continuing to go, whether you're elected in or not. We really appreciate you spending the time to answer a lot of these questions. So attendees, thank you so much for attending, whether you attended live or recorded. We hope your questions were answered. If not, well, it's time to vote, and then you can ask them when they're elected into office. So I did put the link in the chat. Make sure that you vote, like Leslie said. Lucille, sorry. Grab your friends, grab any dietitian or NDTR or students that you know, and get them to the office to vote. So thank you so much. Have a great night, everyone. Thanks, candidates.
Thanks.